Bismillahirrahmanirrahim. Assalamu alaikum, dear students. Dr. Rizwan here from the Department of Biochemistry, Independent Medical College, Faisalabad. Today we will start from the topic vitamin A. In previous lecture, we have covered the classification of vitamins, difference between fat soluble and water soluble vitamins, introduction and sources of vitamin A, absorption, storage, transport and excretion of vitamin A. And today we will start from the biological role of vitamin A. Vitamin A has a different variety of functions in the vision, in the growth, in reproduction, in maintenance of epithelial cells, in glycoprotein synthesis. It has a major role in the MBBS synthesis. It has a role as anti-cancer and the formation of a cataract and role in the general metabolisms of the body. Starting with the role in the vision, it is a component of a visual pigment, that is the rhodopsin. Retinal, it is bound to the protein opsin and perform different functions. Vitamin E deficiency causes the loss of appetite, which slows the bone growth and affects the central nervous system. Retinol and the retinal, these are essential for the normal reproduction. It is essential for the normal differentiation of the epithelial tissues and the mucous secretions. And all these functions we will discuss one by one. And starting with the first function, that role of vitamin A in the vision. It has a vital role in the visual cycle, which is also known as the Wald's visual cycle. It is a process by which a light impacting on the retina of eye, it is converted to an electrical signal. The optic nerve carries the electrical signals to the brain in the form of a nerve impulse, and the brain processes the signals into an image. The retina has a light sensitive layer of the cells at the back of the eye where an image is formed, and the retina consists of a rod and cone cells. These are the photosensitive cells. The rod cell process the black and white image, and the cone cell process the color image. This role was established by George Wald in 1966. The retina has two types of the photoreceptor cells. One is the cone cell and other is the rod cells. The cone cells specialized for the color and the detailed visions in the bright light, and the rod cells are involved in the night visions, which are affected by the vitamin A deficiency. The human retina has about 3 million cone cells and 1 billion rod cells. The outer segment of the rod cells has a disc-like membranous vesicle which serve as a light receptor. About 80% of the protein in the membranes of these vesicles is the rhodopsin. The normal vision depends on the retina and on adequate provision of the vitamin A. In the retina, vitamin A is in the form of retinal, which is bind to a protein which known as the opsin to make rhodopsin in the rod cells. And the rhodopsin, it is a light sensitive pigment. The rhodopsin, in the presence of light, through a series of events, is converted into opsin and all-trans retinal. The all-trans retinal is isomerized to 11 cis retinal in the presence of isomerase enzyme. From blood, all trans retinal is converted into all trans retinal by retinine reductase enzyme in the presence of NAD. The all trans retinal is then isomerized to 11 cis retinal. Simultaneously, From the blood, all transretinol is isomerized to 11-cis-retinol, which is then converted into 11-cis-retinal, that is the active form, in the presence of an enzyme, that is the retinol dehydrogenase. The 11-cis-retinal combines with the opsins in dark to form the rhodopsin. This is the visual cycle which needs continuous supply of the active retinol from the blood to the retina. When this stimulated by the light, vitamin A isomerizes from its bent cis form to a straight form, that is known as the trans form, and detaches from the opsin. This opsin molecule changes in the shape, which sends signals to the brain via optic nerve, and image is formed. The most retinal released in this process is quickly converted into transretinol and then into the cisretinol to begin another cycle. The role of vitamin A in the vision in the dark adaptation time. This is described as the bright light depletes rhodopsin. This process is also known as the photobleaching. The sudden shift from the bright light to a dark light causes difficulty in seeing, and the rhodopsin is synthesized in a few minutes and the vision improves in the dark. The time required to synthesize rhodopsin in the dark is known as the dark adaptation time. It is increased in the vitamin A deficiency. The process of rhodopsin bleaching: when it is exposed to light, the color of rhodopsin changes from red to yellow. It occurs in a few milliseconds and unstable intermediates are formed. The rhodopsin, it is converted into pre-lumirhodopsin, which is further converted into lumirhodopsin. Further it is converted into metarhodopsin 1, metarhodopsin 2, and finally the all transretinal plus opsin, they are formed. When the light strikes to the retina, a biochemical changes occur and the membrane hyperpolarization occurs, which generates a nerve impulse. This hyperpolarization of the membrane is brought about the visual cascade, which involves the cyclic GMP. The other basic factors stimulating the rod cells is the cis-trans isomerization. Photolysis of the rhodopsin closes the sodium channels in the rod membrane, and hydrolytic enzymes releases the calciums into the cytosol, or the decrease in cytosolic cyclic GMP. This lowers the sodium permeability to the membrane, causing the hyperpolarization, and start of visual cycles occurs. The visual cycle involving the cyclic GMP, photorhodopsin, it is converted into metarhodopsin 2. With the help of generation of a phosphate bond GTP, it is converted into GDP, and in active form of transducin, it is converted into transducin in its active form, and it converts the inactive form of photodiesterase into the photodiesterase active form. Hence, in this process, the 3 and 5 prime cyclic GMP, it is converted into its active form. The decrease in the cyclic GMP, it closes the sodium channels in the membrane of the red blood in the rod cells, which results in hyperpolarization. An excitatory response transmitted through the neurons network to the visual cortex of the brain is. The other functions of vitamin A are the growth and differentiation of the cells. The retinoic acid, it is necessary for the cellular differentiation. It is important for the embryo development, gene expressions. The retinoic acid influences the production, structure, and the functions of epithelial cells that line the outside skin and the external passage like mucus forming cells within the body. Regarding the epithelial cell integrity, the many epithelial cells requires vitamin A for the proper differentiation and the maintenance. The lack of vitamin A leads to the dysfunctions of the epithelium. The skin becomes keratinized and scaly, and the mucus secretions they are suppressed in the deficiency of vitamin A. The vitamin A in this diagram shown that it maintains the healthy cells in the mucous membrane, and without the vitamin A or the deficiency symptoms, the normal structure and the functions of the cells in the mucous membrane they are impaired. The role of vitamin A in the immunity, the deficiency lead to the decreased resistance to the infections. The supplementations may decrease the severity of infections in the affected person or the person which are suffering from the deficiency of vitamin A. It has a role in prevention of cardiovascular diseases, and that role is best describes as a antioxidant capabilities of vitamin A. Regarding the role of cancer, the beta carotene is an antioxidant and trap peroxy free radicals in the tissues at low partial pressure of oxygen. This serves the organisms from the toxic effects of the free radicals to produce cancer. For this vitamin A, it is also called the anti-cancer or the antioxidant vitamins. Reason being, it has an antioxidant capabilities. The lung, oral, and the prostate cancer, these are best saved by the administration of vitamin A to the patients. The studies indicate that the vitamin A containing foods are more protective than these supplements. Before going to the daily requirement, I must add its role in the MPS synthesis, that is the muscle protein synthesis. The ground substances contains the MPS as an important constituent. The vitamin A is involved in the synthesis of this chondroitin sulfate. So it play a role in the MPS synthesis. The deficiency of vitamin A lead to the formation of cataracts in old age. In general metabolisms, vitamin A seems to be needed for the conversion of trioses to glucose and the synthesis of cortisol. Mitochondria swells in the vitamin A deficiency. Now we'll discuss the daily requirement of vitamin A. An adult male and female needs about 3000 international units per day. The recommended daily intake is 5000 international units per day. In state of deficiency, like in pregnancy, in lactation, during growth, and in the hepatic disease, 50% more requirement of vitamin A is required. The deficiency of the vitamin A, due to the vitamin A, the certain group of diseases these are produced. Number one is the nyctalopia, that is the night blindness, xerophthalmia, white hot spots, keratomalacia, and complete blindness in the case of severe deficiency. The night blindness or the nyctalopia, the visual acuity is diminished in the dim light. It occurs as a result of inadequate pigment in the retina. The dark adaptation time it is increased, and it is found in the pregnant women in some instances, especially during the last trimester of pregnancy, when the requirement of vitamin A it is more required, or its requirement is increased. The second disorder is the xerophthalmia. In the most specific visual acuity disorder, and it is the leading preventable cause of blindness. Conjunctiva become dry, thick, and wrinkled, and the conjunctiva gets keratinized and loses its normal transparency. The cornea becomes glazy and lusterless. The third disorder is the Bitort's spot, the tissue spots that develops around the eyeball causing severe dryness in the eye. It is seen and recognized as a grey whitish triangular plaque firmly adherent to the conjunctiva that easily distinguishable and diagnosis as a deficiency symptoms of Bitort spots of the vitamin A deficiency. Keratomalacia. It is one of the major causes of blindness in India. The cornea becomes soft and may burst. The prolonged xerophthalmia leads to keratomalacia, and if the eye collapses, vision is completely losses. Other symptoms includes alteration of the skin and the mucous membrane, hepatic dysfunctions, headache, drowsiness, and peeling of the skin. These are the symptoms which are developed due to the deficiency of vitamin A. The assessment of this deficiency, this can be assessed by the dark dioptration test, serum retinol binding protein, and serum vitamin A. The toxicity symptoms, these are produced when eating the liver of the polar bear. 1 ounce of the polar bear of the liver, it is enough to kill a person due to the presence of maximum amount of vitamin A which is stored in the liver of this polar bear. The excess supplementation of vitamin A also lead to the toxicity symptoms. It results in hepatomegaly, increased cerebrospinal fluid pressure, disturbances in the calcium homeostasis that can lead to the skeletal decalcification and tenderness of the long bone. In the skin, there is excessive dryness and desquamation. The therapeutic uses of vitamin A, it can be prescribed in the dietary deficiency. The retinoic acid can be prescribed in the case of psoriasis, promyelocytic leukemia, and acne. So we have completed the different functions and biological role of vitamin A up till now, its synthesis, its sources, its absorption, its storage, transport, and its excretion. In the next lecture we will start with the second fat soluble vitamin, that is the vitamin K. So thank you very much students. Allah Hafiz.